I'm Scott Porter. I'm the Senior Director of Channel Development here at ECRM on the Pharmacy and Medical Markets team. And we are here at Specialty Pharmacy session in San Antonio, Texas. I have the honor to be joined by Cheryl Allen, who is Vice President of Industry Relations with Diplomat. Thank you very much for being here. And really appreciate you once again hosting one of our thought interaction pods. You had it looked like a great conversation, very popular once again. I think this is the fourth year you've done it. I think you've done it each year that we've had it. So thank you for the support and helping to continue this program to grow. You had your discussion was focused around a couple of, case studies.
Sure, right.
Prostate cancer, rheumatoid arthritis, or RA.
Exactly.
And the role and how that's affecting specialty pharmacy. Did I have that right?
You do. You do.
All right. Well, if you wouldn't mind, just share a little bit about what took the conversation that took place, what others had to say, and.
Perfect. Yeah. Our session was really to look at different opportunities to effectuate, patient journey with a couple of case studies. And the topic really built on what we discussed last year. Last year we looked at the specialty generics pipeline, and then we also looked at biosimilars and what we think this will mean for specialty. So in that first case study, we looked at specialty generics, and in 2018, we all here in specialty had a great opportunity to help support a generic for Zytiga. So it was abiraterone, and although we watched it all year long, it finally hit in late October. So it was into Q4 before we were able to work on it. But the discussion around the table was really sharing our insights on how prepared we were to help support the patients, the prescribers, and the payer with that generic, and availability to the patients. So, we had folks at the table from, of course, specialty pharmacies, we had pharmaceutical manufacturers, and then we had service organizations. So, some key learnings were that, now we've done a few of these specialty generics opportunities here in our sector, and we felt like we were more prepared for Zytiga. We did things like identifying patients who were available for those conversion opportunities. So that was good, and many of the specialty pharmacies were doing the same. I think probably across both groups that we talked to, the biggest learning there was really feedback from the payers with what they were doing with respect to those generics. So I think at the end of the day, as we continue to work with specialty generics, that we'll continue to gain insight on where we see opportunities for savings across the entire healthcare space, and how we can support patients and prescribers and payers with these conversion opportunities.
Any issues with availability of these drugs, or?
I don't think so. So the channel seemed to be quite prepared. So the drug was available in the broader wholesale channel. And there were some opportunities for the direct availability as well. So I don't think availability was as much of an issue as maybe some reimbursement challenges at the specialty pharmacy level.
Got it. And then was it a significant price decrease to the patient for the generics? And
well, that's interesting, right? Because in prostate cancer, many times we have patients who we can't use commercial copay cards, right? So the generics came to market without those copay cards, but you can't use them in the Part D population in the first place. So we continue to struggle with oral oncolytic patient cost share across the sector, and while the specialty generics do offer some bit of savings, we still have to consider that this is a considerable out of pocket for these patients.
So how did the case study around biosimilars go?
Wow, that was interesting. As I said, we built off of last year, so we looked at the pipeline and we looked at the approvals to date. So we have 17 approvals, actually 18 because one was approved just last week. Wow. In the biosimilar space. I think we find it challenging in the biosimilar space because the way that the drugs are being approved, they're not interchangeable to date. So what that means essentially is they're coming to market as their own brands. So the prescription has to be written for that specific biosimilar. So I think across both groups, the discussion was a more, wait until we have a biosimilar that's approved within a patient self-administered therapeutic category, such as adalimumab, or we do have Erelzi, but it's not yet launched. So those are some opportunities. But really, the big game changer here will be if we have interchangeability, and that will allow us a lot of flexibility, allow us to really bring the cost savings into the entire healthcare sector. So fingers crossed.
Yeah, absolutely.
Yes.
Thank you once again. Really appreciate you taking part, the support of ECRM, and then serving as a host in our Bot Interaction Pods.
Thank you, Scott. Thanks for the opportunity.
You bet.